Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 23rd, 2025. This video is on a Nature Reviews drug discovery article titled GLP-1 based therapies for diabetes, obesity, and beyond. What is GLP-1 and how does it work? GLP-1 is a gut hormone that enhances insulin secretion, inhibits glucagon, slows gastric emptying, and reduces appetite via CNS pathways. Why is GLP-1 effective in treating type 2 diabetes and obesity? It reduces blood glucose and promotes weight loss by acting on pancreatic cells and brain centers that regulate hunger. Approved GLP-1 therapies. What are the currently approved GLP-1 therapies? Exenatide, liraglutide, dulaglutide, semaglutide, and Tirzepatide with different dosing schedules and indications. How does semaglutide differ from Tirzepatide? Semaglutide targets glucagon-like peptide, GLP-1 receptor alone, while Tirzepatide targets both GLP-1 receptor and glucose-dependent insulinotropic polypeptide receptor GIPR, offering superior efficacy. It's a dual mechanism. Next generation and safety. What are GLP-1 based multi-agonists? Drugs combining GLP-1 with other targets like GIP, GCGR, AMLNR to enhance the metabolic effects. Are there oral GLP-1 agents? Yes. Semaglutide approved orally. Several others like danuglipron and oroforglipron are in development. Efficacy and side effects. How much weight loss can these drugs achieve? Up to 17% with semaglutide and 20.2% with Tirzepatide. Higher doses may exceed 25% in select trials. What are the common adverse effects? Nausea, vomiting, diarrhea, primarily due to CNS and GI tract GLP-1 receptor activation. Duration and regain. What happens after stopping GLP-1 therapy? Most regain weight, up to 2/3 in some semaglutide users. The Tirzepatide may have more durable effects. How long should therapy be continued? Possibly long term, indefinitely. Predictors of durable response are under investigation. Sarcopenia and muscle loss. Is rapid weight loss safe for muscle mass? Not always. Risk of sarcopenia exists. Research focuses on muscle-sparing combinations. Can diet and exercise help? Yes. Resistance training and protein intake enhance fat loss while preserving lean mass. Emerging indications. What other uses are being explored? GLP-1s are being tested in sleep apnea, heart failure, liver disease, arthritis, addiction, and cognitive decline. What's the role of CNS in GLP-1 efficacy? Multiple brain regions mediate hunger suppression and side effects. Targeting specific circuits is under study. Some eponyms related to diabetes care. Incretin effect. That's the physiological effect where oral glucose triggers more insulin than IV glucose via incretins like GLP-1 and GIP. Islets of Langerhans, discovered by Paul Langerhans in 1869. These are pancreatic cell clusters where GLP-1 enhances insulin secretion. Banting, Best, and MacLeod. Frederick Banting and Charles Best discovered insulin in the lab of Dr. J.J.R. MacLeod. In fact, Dr. MacLeod and Banting got the Nobel Prize. GLP-1 therapies extend the legacy of insulin-based diabetes care. Whipple's triad, classic criteria for diagnosing insulinoma. GLP-1 therapies are contraindicated in certain endocrine tumors. Himsworth classification, 1936 framework dividing diabetes into insulin-sensitive and insulin-insensitive, a key for type 2 diabetes subtyping. A side note, Himsworth's son was the chair of medicine, Professor Himsworth, at University of Aberdeen when I was a medical registrar there. Fayens-Conn syndrome characterizes endogenous hyperinsulinemic hypoglycemia relevant to GLP-1 receptor agonists use with insulin. Finally, the Mayo score is used in NASH and trials. Key future targets for GLP-1 is beyond diabetes and obesity. Anyone interested in the discovery of insulin should read the book by Michael Bliss. It discusses the controversies between the authors, between the contributors, and I first came across the book when I was at the University of Aberdeen, and MacLeod returned from Toronto to become the Regius Professor of Physics in Aberdeen. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.